What's up, is your favorite NPHP, and welcome back to my channel. As you can see by the title, we are going to be discussing and going over some benefits of working as a registered nurse before becoming a nurse practitioner. If you are new to my channel, my name is Harriet. I am a certified nurse practitioner. I've been practicing now going on 7.5 years as a nocturnal hospitalist nurse practitioner. Please watch to the end of this video because I always end my videos with an encouraging, uplifting, motivating Bible verse that I don't want you to miss. So let's jump right into it. So if you watched my last video about my journey through healthcare, I'll link it above. I did discuss that I was actually going to go straight into grad school. So I wasn't going to work at bedside as a registered nurse, but the Lord stopped me. He put a hold to that. He's like, nope, I couldn't, because I ended up pregnant my last year of school, and everything happens for a reason. So I'm actually happy it worked out that way, because I feel like there are many benefits of working as a registered nurse before becoming a nurse practitioner. So number one is you understand what you're getting yourself into. Before I talk about working as a nurse before becoming a nurse practitioner, let's bring it back to working as a nursing assistant, a patient care assistant, a student nurse tech, whatever your facility may call it, or even if you're able to shadow a registered nurse, just so you know what you're getting yourself into when you're becoming a nurse. I did have a fellow nursing student, after working a couple weeks as a registered nurse, she actually quit. She stopped and she said, this is not for me. So if you have the chance to shadow or become a student nurse tech or nursing assistant, I think it's worthwhile. Going forward and working as a registered nurse before becoming a nurse practitioner, you just know what you're getting yourself into. When you're a nurse, you're working hand in hand with a provider. The provider is either going to be a nurse practitioner or a doctor. And I do recommend starting off on a med-surg unit. Later, if you're deciding on becoming a cardiac nurse practitioner, you could then go to a cardiac floor and work hand in hand again with the cardiac nurse practitioners, the cardiologists. The second thing is you understand what it means and what it's like to work in healthcare in general. That speaks for itself. During your shift, there's going to be new orders popping in. There's going to be communication with family members throughout your shift, communication with the providers, communication with consult teams, communication with PT, OT, lab, calling you for abnormal labs, or you need to repeat a lab, because it could be overwhelming just getting to know what healthcare is all about. Which leads me into number 3, and it's getting used to talking and communicating with patients and family members. Nurses are known for being compassionate and having so much empathy when it comes to, their patients. So being able to learn how to communicate with patients, we're not always standing above them and talking down to them, right? When I'm going to see a patient and I see an available chair, I'm pulling the chair up so I'm at eye level with them. And that's just something that's embedded in me. And since working in the hospital and working as a nurse, we learn to just be more empathetic and just be more softer and more calmer with the patients and with family members. Going back to getting used to healthcare, there's sometimes there could be almost 8 to 10 patient family members in a room, and you have to be comfortable with that, because you have to go in and still take care of that patient. You can't be a shy little nurse when you have all these family members around you asking you different questions. So that leads me to number 4. You learn how to be a team member, a team player. It takes a lot to be an amazing nurse, right? You're not doing it alone. Yes, you might have your designated 4 to 5 patients. When a patient is an assist times 2, you need to grab another hand. If it's the PCA or if it's another nurse, you need a fellow hand to help you. If it's wasting a medication, you need another nurse to waste with you, double checking a medication, double checking your drips, your heparin drips, your insulin, your blood pressure drips, like your cardamom drips. You need a nurse. You're going to need a nurse to help you, and you have to learn to be a team member, a team player, whatever you want to call it, because you're not going to survive if you don't. The culture on floors could be a little bit toxic, but if you come in with a positive attitude and if you're willing to help others, they should be willing to help you too, right? So yeah, you just learn to be a better team player, and you could take that with you when you become a nurse practitioner and learn to be a team player with your providers and at the same time with nurses. So this actually reminds me of when I was going to, as a provider, as a nurse practitioner, I was actually a couple weeks ago admitting a patient from the ICU. So they're just switching floors, leaving the ICU, coming to a med-surg floor, and I went to go see the patient, but the patient was in the bathroom, and the PCA, the nursing assistant, was making the bed up. She was coming in, she was like rushing. She had the sheets in her hands, and I'm standing there, right? Because the patient's in the bathroom. So I'm standing there, but I see her, about to make the bed. And what do? I put my papers in my pocket, or, I set my papers down and I begin to help her. I'm on the other side, she's on the other side. I'm putting that fitted sheet on, I'm helping her with the pillowcase. And she was just so, I don't even know if it was surprised or what she felt, but it was like she was praising me and thanking me for helping her make a bed. And I'm just like, I've been there. I was a PCA for at least 2 to 3 years. What would I look like just standing there watching her make a bed and struggling by herself? And I'm standing there and I have two hands. I could help her. I'm not seeing the patient just yet. So like I said, you just learn to be a team player, and hopefully it sticks with you. My fellow nurse practitioner, who's amazing at IVs, she's at bedside till this day helping with IVs. They know to call her, and she's up at it, and she'll be in that room, and they know what she needs. She'll just tell them, have her stuff at bedside. She's still putting in IVs. Like, you have to be a team player. We cannot, as one person, take care of a patient. It takes a lot of us when it goes from the PCA, the nurse, and the providers, and everyone else, like environmental services, making sure the room is clean. Even their family members could help. And then like all the consult team, it's just like you just learn to be a team player, because there's so many hands involved when it comes to caring for patients. So the fifth benefit is basically just helps you learn more in real world context, like real world or real healthcare context, I should say, right? So it's like till this day, it's like I know what a GI bleeder. Sorry for the examples that I have, but I know what a GI bleeder smells like. I know what a C. differ smells like, right? I know what a cirrhotic patient looks like. I mean, I'm not going to walk in as a provider and I see this patient's skin that is yellow as the sun and their belly's distended as if they're 8 months pregnant. It's like you experience so much that is just going to help you in the long run. You're not going to be surprised, seeing these things, smelling these things. It will definitely bring back memories, but you just have real world context in what patients' presentation should look like. What should they be presenting with? Going back to seeing a cirrhotic patient as a provider, and I've been there. I mean, yes, I have years now under my belt, but like if I was a new grad and I worked as a nurse, I could just look at them and see, yeah, they are decompensated liver cirrhosis, because I know what they look like from my experience working as a registered nurse. So this leads me into number 6, and you have the basic medical knowledge that you will now expand on when you're going back to NP school, right? I remember when I was in school, and when we're talking about different disease processes, a light bulb will go on because the patient that I was just caring for that night before had that diagnosis. So I was able to see it firsthand, and now I'm seeing it on paper. Now I'm seeing that, that's why they ordered that lab. That's why they ordered that testing, because they want to further see this. They want to further diagnose that. You want to further, rule in this or rule out that. So you get to expand on your knowledge, and it's so wonderful when you're sitting in school and that light bulb that light bulb goes on, like ding, ding, ding. I know what she's talking about. And it's like when you're putting things together on your own, I mean, it helps you in school. Things are not going to be as hard and difficult because you've seen it before. You've seen the orders come through. And now you're understanding it and putting things together. It's like, just what an amazing feeling to actually sit there and put things together on your own. And it's like, that decreased your study time because you already know. You already experienced it as a nurse, and now you're learning about it further, just going a little bit further deeper into that topic as a provider. But it's like, it'll be easy for you to retain, easy for you to remember, and easy for you to get good grades. Last but not least, number 7 is basically you're able to now know why. Why are you going back and becoming a nurse practitioner? And it could be for so many different reasons. Felt like you had enough of being at bedside, and now you want to be a provider. You want to be on the other side, who's putting in the orders, who's putting in the treatment plans, and you want to now expand your knowledge as to why you are, if you're one of those nurses who are always questioning why did they order that scan, why did they order that labs for my patient, and you just want to dig deep, further your education, further your expertise. You just know why now you want to become a nurse practitioner. And at the same time, which nurse practitioner? I recommend working on a med surg floor, but you could venture off and become, if you go to the ICU or go to the ED, and you now are seeing yourself becoming an acute care nurse practitioner, or Like I mentioned before, if you're a cardiac nurse and you want to become a cardiac nurse practitioner, being there, hands-on, being able to discuss and talk with your provider, with the nurse practitioner on, and seeing what they do firsthand, it's just amazing. And so now that we're done discussing the amazing benefits of working as a nurse before becoming a nurse practitioner, the question is, should you work as a nurse before becoming a nurse practitioner? It's only going to benefit you in the long run. But also, some master programs may require you to have 1 year experience. You have to pay close attention to that when you're choosing schools. At the same time, there are providers out there who did not work bedside and are wonderful providers. So it is possible to, not have the bedside experience. Obviously, it's not mandatory, only if there's a graduate school you go to requires 1 year of experience. Just know, working as a registered nurse before going back to becoming a nurse practitioner, it will only benefit you. So let's end this video with an amazing Bible verse. And today's Bible verse is Romans chapter 12, verse 2. Do not conform to the pattern of this world, but be transformed by the renewing of your mind. Then you will be able to test and approve what God's will is, his good, pleasing, and perfect will. This verse is just explaining that you should not become like the people of this world, and you should let God completely change the way you think. Allow him to change your mind so you live differently. Then you will understand what God wants you to do. And God knows what's best for each and every one of us. His path is always the right path. Be willing to listen to him and allow him to guide you. I always love to reiterate that I did not get here on my own. The Lord has held my hand and guided me on this journey called life.